People with weakened immune systems will soon be eligible to get a third dose of COVID-19 vaccine to improve their protection.
The CDC signed off on that this afternoon after FDA authorization yesterday. News specialist Jed Bowles shows us who this helps.
These third doses are for people who have compromised immune systems, people who've had an organ transplant, or they're on some kind of treatment for cancer. Well, the state epidemiologist tells me that they have doses for all of these folks in our state.
And so for most of us, we just needed 2 shots and our bodies are ready to go. They're going to fight off that virus.
Unfortunately, state epidemiologist Dr. Alicia Nolan tells me that's not the case for people who have some immune conditions, especially as the highly transmissible Delta variant spreads.
There's 2 good studies out there that have shown that people with some certain immune conditions, if they get a third shot, it really helps their bodies get on top of things.
According to the CDC, immunocompromised people are about 3% of the population, but they have more than 40% of hospitalized breakthrough cases.
Immunocompromised people have a much higher rate of severe outcomes when they get sick with COVID, and they don't necessarily respond as well to vaccinations.
An additional dose of the Moderna or Pfizer vaccine given at least 28 days after their last dose. It does not apply to the Johnson & Johnson vaccine. In the CDC meeting today, several people talked about the big difference this extra dose might make for them.
One individual who has incurable cancer, who wants to extend her life as long as possible, she wants that third dose so she can be close to family members so that she can gather with people.
The Utah Department of Health has a large supply of vaccine.
We have over 300,000 doses of vaccine here ready to go.
Enough to vaccinate all of those people in our state. And what about boosters for the rest of us?
So right now, there is no recommendation that people with healthy immune systems go get another dose. So we'll keep our eyes open. We're happy that people are looking at this. And when we see evidence that we need to, we'll be able to do that.
Both doctors urging everyone to get their shot to help protect the entire community. For KSL 5 News, I'm Jed Bowles.